Good morning. I'm Nicole with the MAIA committee, and I wanted to introduce our speaker for this session, Kim Irwin. Kim is the executive director of the Alliance for Health Promotion. She has a master's of public health from the Indiana University School of Medicine Department of Public Health and an undergraduate degree from Northwestern University. Her entire career has been spent in health-related program and administrative management. And she has been the executive director of the Alliance for Health Promotion since January of 2008. Welcome, Kim.
Thank you. Hi, everyone. How are you today? Good. I think I'm going to take the time and have you all introduce yourselves. It will help me tremendously, and if you can try to keep it like within under 20 words is what I'll say. And then I think we can move through quickly enough to make it worth doing. I'd love to hear, your name and what brings you to this conference from a professional or personal standpoint. And then I'm also curious what about this topic, whether it was the title, or if you feel like you know something about it, what interested you in coming into this session specifically? So, do you mind starting?
Yeah, sure. Tom Danahy, I'm a YMCA director. YMCAs all around the state have been on a state alliance, been interested in how we can get more safe streets and more bike paths and things, and we're asked to do that in our community. It's quite a challenge, and so this immediately perked my interest.
Okay, great.
I'm Rhonda Zuber, and I'm the president of SWRCA and more. And this is something that's right up SWRCA Valley. I'd love to incorporate it with what we do on a daily basis.
Great, wonderful.
My name is Melanie Wilkinson. I'm a case manager for SWRCA and more. And this perked my interest due to working with the aging population and trying to come up with just more resources or different ideas to bring to the community.
My name is Venetia Wells. I am a health professor. Just wanted to attend this session just to learn whatever I can do about health and aging.
Great.
Brenda Roger, and I'm case manager at Health South. Ditto to what everybody else says.
Okay.
Health is my job.
Excellent.
Carol Vance, Area Agency on Aging, Area 14, Lifespan Resources. We work with the aging disabled.
Wonderful.
I'm Debbie Wilson, a social worker at Evansville State Hospital. I just turned 60 this year, so I'm living for my selfish reasons.
Good for you.
Kathy Sherbaum, I'm a practitioner in Illinois, and just to attend for some ideas for our population.
Based on where I work at Jasmine once was a CNA, and I did work with aging.
Great. Okay, thank you.
I'm Sister Judy Flowers, and I work with our aged and retired sisters. And I was just hoping I could learn some things that would help us.
Wonderful. Thank you.
I'm Suzanne Dale, and I just am learning to be old. And I like the idea of the age being active in the community, so that's one thing.
Wonderful. Thank you.
I'm Lynn Bridle, and I'm a retired person, and I want to remain healthy. So I guess.
Excellent. We wrote a good blurb, huh?
Tammy Dennis, and I also work for Area 7 as a case manager, and it's very pertinent to what we do.
Okay. Excellent.
Rachel Ball, I work as a CODA in a skilled nursing facility, and I see so many people that we're trying to get back home. I see what struggles they have.
Great. Very good.
I'm Bill Tinker from Grinnell, Iowa, and I'm here basically because my wife can't be in two places at once.
I love it.
And so to take notes.
Yes, all right. And we're going to have it as a podcast, right? Yes. So you can listen to it later. Great. Thank you for joining us.
I'm Janet Razor. I work at St. Mary's, and I'm on a community healthy community partnerships, and we're looking at this.
Yeah. Great. part of that too.
Yeah. I'm Mary Hopper. I teach first-year medical students at Ivy School of Medicine. I think it's important to be able to share these resources with medical students, try to put people back out into their normal lives, and also I'm very interested in expanding my research to address gerontological focus. So
Very good.
I'm Julie Warner from Home Instead Senior Care here in Evansville, and I would like to learn more to be able to incorporate this into our daily getting out to the clients.
Great. Very good.
I am Megan Borman, and I also work at St. Mary's, and through our post-acute care program, wasn't able to get on the committee, but my background is in exercise physiology as well.
Great.
Right in MAIA.
Good.
I'm Ruth Metzger. I'm with USI. I did the original research to start Wilburn Foundation on its Healthy Communities and Healthy Schools programs. I'm right now working on a doctorate in public policy, and I believe that policies that support people of our age staying active and healthy also help everyone else too.
Good to see you. It's been several years. So
Yeah.
great.
I'm Melissa Meredith, and I work at SWORCA, and we support active and healthy aging.
Definitely.
I'm Amber Ferrari, and I serve on the committee as well, working at St. Mary's and looking at how we can help our community and patients that are leaving the hospital.
Excellent.
And I'm Nicole McCord. I'm on the committee, but I also work at Parkview Care Center, which is an area skilled nursing facility. And just wanting to see if I can take some ideas back. We're seeing a lot younger population now, the baby boomers coming through 50s to 60s. And anything we can do to help them better their health would be amazing.
Very good. Well, thank you all for taking the time to do that. My name is Kim Irwin. I'm the Director of the Alliance for Health Promotion. I'm going to talk with you about our work. I really want this to be interactive, so please stop me at any time with questions. I'm going to ask you at different times for sort of how what I'm saying resonates with your life or work experience, so would love to have your input on that. And we'll finish up with enough time to have some formal Q&A as well. I'm just going to start this timer now. You may have seen this. We're going to talk about the built environment and public health, and I'll define the built environment in a moment so we're all on the same page with that. We're going to talk about how that impacts older adults' abilities to be safe, active, and engaged where they live, where they want to be. And then we're going to talk about what we call a policy, systems, and environmental change approach to improving community health. And our work really applies for people of all ages and abilities. We talk about from 2 to 102. Sometimes we say 5 to 85, and people always stop us and say, why are you stopping at 85? So we're going to, maybe at 2 to 112. We should just embrace the lifespan for as long as that is. And so talking just about, again, how do we create the environments where people can be healthy, where they can be active, where they can be engaged. And we'll get into a little bit, number one, what that looks like, and number two, how we get there. I will say, sort of as a disclaimer, there are absolutely things that you will be able to walk out the door today and hopefully think, like, I can do this immediately. But the other thing about this work is that it's very long-term, because it's policy-oriented, and so, it's infrastructure. We have to make infrastructure changes. Those things take time. Road projects don't happen overnight, unfortunately, sometimes. And so it's really important to have the long view with this, which can be sometimes frustrating when you're in the middle of it, but also really, from our standpoint, an approach or a way of thinking that will get us where we need to be. So I'm just hopeful that by the end you'll understand the links between the built environment and public health and what that means for older adults. And also that you'll take away at least 3 policy systems and environmental changes that can be integrated into your work or the broader work in your community. So our work, the Alliance for Health Promotion is the nonprofit name, that's what I'm the director of, but our work is really branded as Health by Design. That's how most people know of us. And primarily, we started in Central Indiana, so our history is there, but we're now definitely working around the state and have been involved, like I said, in some work down here. What Health by Design is all about is a coalition of partners, and we work to ensure that our neighborhoods, our public spaces, and our transportation infrastructure promote physical activity and healthy living. We have priority goals that were established in 2006 when we got started, and those remain the goals today. At the end of the day, it boils down to walking, biking, and public transit. We're all about getting more options in place for that, which again, a lot of times is about having infrastructure in place. We talk about it from a connectivity standpoint, so literally connectivity in, can I walk out my door and cross the street to get to the grocery store that's across, or connectivity on a regional scale or even a statewide, interstate scale. Can I get, from facilities in Du Bois County to the VA hospitals in Evansville area, right? Like with, what are my connection options to do that kind of thing? Land use decision making that promotes public health, and land use is kind of a wonky term, but basically is about how we use land, what we build on it, and where we build it. So having like residential areas or commercial areas or agricultural areas, and how those are intermixed or separated, and that kind of thing. Planning and zoning laws impact land use. But land use is a key component of this. And ultimately, we want to reduce dependency on automobiles. And, over the years, sometimes people say, oh, Kim hates cars, she wants to get rid of cars, that kind of thing. That's not what this work is about at all. This is about having choices, about having options for how we get around. And I'd argue that particularly with older adults, those choices become critically important. It's almost part of, I feel like, day-to-day, week-to-week, popular media, and certainly your work and lives, this whole conversation of my parents can't drive, or they've been involved in a car crash and it's become clear that they're really not able to drive anymore, we need to take the keys, but one, they don't like it because they feel completely then limited and isolated and cut off from the world as they know it, and number two, what are the options, right? Is an adult child or somebody else going to have to provide that transportation all of the time? So the options that we have and how we get around really guide our ability to be active. Under that Health by Design umbrella, we have convened, or we have had work groups, and over the years those have evolved, that we have 5 work groups. The orange circle up here, you probably can't read it very well, but that's the Indiana Citizens Alliance for Transit. So we do a lot of work around transit policy and advocacy, particularly at the state level with the legislature and the Indiana Department of Transportation and that kind of thing. So we have a transit work group that's branded as ICAT. We have the Indiana Safe Routes to School Partnership, which is all about making it safer for kids to walk and bike to school. How many of you walked or biked to school as a child? Okay, probably about half of the room. How about today, in your own children, your neighborhood children, that kind of thing? Many? Okay, none in this room, it appears. So, that is a shift we've seen over the last 40 to 50 years, and we come from the perspective that although there are lots of reasons, and even legitimate reasons, why kids don't walk and bike, we're not better off for it, kind of thing. There's a lot of benefit to be gained by recreating environments and making it safe for kids to do that. We have a pedestrian work group that convened about a year and a half ago, branded as Indiana Walks, and I'm going to say it now in case I forget at the end. We are planning the first Indiana Walk Summit. We've had a bike summit in Indiana for a couple of years, but the Walk Summit is later this month. It's the 27th and 28th, half day Wednesday afternoon, full day Thursday. You can do one or both, but I'd love for you to think about attending that if it makes sense for you, and spreading the word as well. So I've got some flyers. And then we also convened the Indiana Complete Streets Coalition. A lot of our work is around complete streets. I'm going to talk about that more later. Is complete streets a term that's familiar to any of you? Okay, a few of you, but not a lot. So I'll get into that in a little bit more detail. But essentially, complete streets, again, is a policy approach that says we're going to accommodate all users regardless of how they're traveling, and ensure that when we do transportation projects, when we spend transportation dollars, it's not just about car only. This is kind of the framework for the public health connection to the built environment. So if we think of the built environment as transportation and land use, and public health on the other axis. There are 4 primary public health connections. Physical activity, which I'm going to go into a little bit more depth about, but that's just opportunities for being active as part of our daily routine. Safety, which I'll also touch on a little bit more, but ensuring that people who are traveling on foot or by bike or riding transit are safe and protected as they do that. We know, and it's kind of like duh, but the data bears this out in really horrific ways, that vulnerable road users, what we call pedestrians and bicyclists, are really at much greater risk, certainly in our transportation system. That risk, I'm going to say it now and I'll probably repeat it, that risk does not outweigh the benefits of doing it, right? So we have to be really careful that when we talk about safety risks of walking and biking, that we're not being alarmist and saying, well, you should never walk and bike then. The reality is, as more people walk and bike, the safer it gets for everyone. But certainly, there's a disproportionate risk in an individual incident that vulnerable road users bear. Air quality, again, somewhat intuitive. Transportation, the transportation sector can contribute up to 50% of air pollution, particularly in central urbanized areas. It's less so in areas with some heavy industry or in more rural areas. But air quality, we increasingly know, we've known for years the connection between air quality and respiratory disease, but we also know that now that air quality and cardiovascular disease correlate, that there's connections to infant morbidity and mortality, maternal child health type things. And so air quality, I'm in the camp that says, we like to pretend in Indiana we don't have air quality problems, but we absolutely do, particularly in our urbanized areas. And unfortunately, it doesn't always look that way. When you look out into the, you don't see air quality issues, but that doesn't mean that it's not impacting us. And again, specifically when it comes to things like asthma and other respiratory illness. And then access, we consider a primary direct public health impact, even though it's also such a broad thing. So access is everything about being able to get to medical appointments. Again, probably something that's very directly impacts many of you. We know, again, people will call 911 to get to, go to the ER for very non-emergent situations because they don't have another way of getting to care. Access impacts, it's about access to healthy fruits and vegetables. So can I get where I need to go to shop for healthy foods? Is that limited in my area? And there's also a connection to disaster response and like homeland security type things that is at play here as well. In Hurricane Katrina, one of the major factors influencing people who died within that event had to do with transportation and the inability to leave to get out of where they were. Then around the circle, it's probably a little bit harder to read, but these are what we would call more social determinants of health, or the other broader factors that influence the health of our communities. And again, I would argue that particularly when we look at older adults, some of these come into even more play. So prevented criminal activity, kind of over at 11 o'clock-ish, prevented criminal activity links to having healthy communities where people are out and about. There's a lot of times concern when a trail is being built, or even sidewalks sometimes, like, I don't want that trail coming to my house because people are going to, ride up and break in and maybe steal the TV and leave with it down the trail, right? But those are legitimate concerns, and they do come up sometimes. Certainly, case after case after case bears out that once a person has a trail by their house, they love it, and the demand for neighbors and others, nearby areas grows. But there's a whole concept called crime prevention through environmental design that really gets at when we have people out on the street, when we have eyes on the street, criminal activity is actually reduced. And so this whole idea of sort of not, it's a cycle, right? So people don't want to be out where it's not safe, but then not having people out where it's unsafe perpetuates that criminal activity potentially. all of the protected natural environments and that connection to nature, and the increasing body of evidence about how valuable time spent in nature, time in green space is for not just our mental health, but our physical health. Economic development, lots of great data that's emerging that when we have walkable communities, when we have transit-oriented areas, that those boost economic development. Businesses want to be there, people want to live there, and so we see this, again, enhanced economic potential as a part of that. The whole idea of mobility and connectivity, very important, and again, we'll go into that in more depth. Community interaction, so the whole idea of social cohesion, interacting with each other on the street, on a trail, just being out and about, being able to be an engaged member of our communities helps tremendously. And then the idea of less traffic congestion certainly makes all of us happy. I caught only the tail end of the keynote. It sounds like I missed a great talk, and I'm guessing there's probably some overlap with things I'm saying, so feel free to point that out as it comes along. But I did see the very end with the slide about isn't this traffic great or whatever, right? So unfortunately, most of us are not thinking that when we're in that situation. But again, having a transportation system that has options that are connected really can serve to reduce some of that. So my talk, and really our work through Health by Design in general, is based in the premise that physical activity is a good thing. Is there anybody that wants to doubt that or question that today? You guys are probably well aware that the benefits of physical activity are significant, and that that there are a lot of really important reasons to ensure that we're active as part of our day-to-day life. Specifically with older adults, I have an article here that I'm happy to share with anyone who's interested, but it really does it's a review article, but really looking at all of the benefits of physical activity in older adults. And overall, we've got reduced morbidity and mortality. We've got significant impact on the prevention and treatment of chronic diseases. Things like agility and flexibility and reduced balance, reduced risk of falls come with being more physically active. All of that connection to spiritual, mental, emotional health is there. And also some good data, and again, you probably see this in your day-to-day work, that the more physically able a person is, the better they are able to take care of themselves, to live independently, to be able to care for themselves in ways that allow them to go home or to spend longer periods of time independently. The important things about physical activity, which again you may know at this point, are that little bits of physical activity are as valuable as long stretches of activity. So accumulating 3 10-minute bouts of physical activity over the course of the day is equivalent to 1 30-minute session, particularly with older adults who may fatigue easily, who just aren't able to sustain an entire session, if you will. That's a really important thing to know. And so that whole idea of how, and again, this is really the premise of our work, how we build physical activity 5 minutes at a time, 10 minutes at a time, 15 minutes at a time into our daily life is what that's all about. When I touched earlier on the policy systems and environmental change model, and what that really is, this is a graphic from the Indiana State Department of Health that essentially says healthy policies lead to healthy environments, which shape healthy behaviors and lead to healthy people. So for decades, our traditional public health approach has been to tell people what they need to do, right? We've done that in many ways. You need to get physical activity and you need to eat fruits and vegetables, right? Well, we all know, and again, it was touched on just at least in the bit I heard of the keynote, knowledge doesn't always change behavior. For certain people it does, but that percentage is really very small. The problem is that the way we'll say it is the choices we make are shaped by the choices we have. And so if we don't have healthy choices at our disposal, it doesn't matter if we know what we should do, we're not going to be able to do that. And we've spent, a lot of years really, you can make the whole argument that our culture has evolved as a very individualized society, right? It's kind of all about me and rugged individualism, and I'll do what I need to do, and nobody should tell me what to do, and that kind of thing. But it's also led to environments, specifically if we think about the built environment, in ways that it really, again, people don't have choices, and as a result, they're not able to walk out their front door and take a walk around the block and head back home. They can't go to dinner down the street and do that using active transportation. So this whole idea that the environments in which we live, work, play, worship, shape our health is an increasingly recognized approach to how we look at healthy behavior. Just quickly, how many of you have a place you could go, whether it's a shopping area, a restaurant, or a church, or a medical center, or even a park within what you would guesstimate is a mile of your house? Okay, so many of you do. How many of you are are comfortable to safely walk or bike to that? Okay, so many of you, so that's good. So certainly distance, I bring this up to say distance and proximity is an important thing, right? It's not realistic to think if you're 5 miles away from a commercial retail area that you're going to walk or bike there. But what we see in a lot of situations is that people have things within a good proximal distance, but they still can't access it. Has anyone heard of WalkScore? Anyone? Okay, Google it, walkscore.com. You type in your zip code basically, or maybe your entire address, and it will give you a score, 0 to 100, with the higher score being the most walkable environment. And there's lots of resources attached to that, so it's a really neat website just to look at. But what's important to know with that, there's been some criticism about WalkScore because it does look at proximity. So it's looking at, do I live near things that I could go to, as opposed to assessing in any way the infrastructure that would allow you to do that. So it's just important to remember there's sort of two factors with that. So again, going back to sort of our approach, why we do this work, the whole idea is that in order to impact public health, to impact physical activity at the community scale, we have to be involved in these discussions about transportation and land use. I've said this, we're talking about integrating physical activity in our daily routines. A great quote that we use often is that essentially as we organized our lives around the automobile as the primary mode of transportation over the last decades, we've engineered physical activity right out of the equation. The other aspect I want to touch on briefly is that this links very much to the idea of place and the equity issues that come with place. We know that where a person lives, increasingly the body of evidence is showing us that where you live determines how well you live. That individual zip code level factors can really shape life expectancy in and of itself. So this is it's a little bit hard to see, but banner that was at a public health conference a couple of years ago, and there's two little boys with their faces, split down the middle. One in one zip code on probably more the East Coast, and the other in California, with two very, 13 years difference lifespan between the two of them. And this whole idea that place and where we are shapes that is really not just for the reasons I've been saying important, but also when we think about equity, when we think about how we're investing resources, where we're investing resources, these become very important considerations. Dr. Richard Jackson, who was involved in a project, the website is designinghealthycommunities.org. It was in partnership with PBS, and there's a 4-part video series, which is really excellent if you're interested in more getting into this a little bit more. It just has made the quote that the built environment is social policy in concrete. Active Living Research is an organization based in San Diego, California, activelivingresearch.org. They have a number of these infographics that really help to demonstrate the research base around these issues. The far one, people who live in neighborhoods with sidewalks are 47% more likely to be active at least 30 minutes a day. Public transit riders, a lot of times people aren't really sure about that public transit connection when we talk about bus or rail in places that have it. But public transit riders take about 30% more steps per day as part of, again, just their day than people who don't. So there's a lot of great, again, research base here if you're interested in that. So I'm actually going to go back to this for a minute. I'm going to ask you to pause just for a minute and think about one of your favorite places. It could be a place you visit, vacation, it could be international, it could be here, it could be your home, it could be your own neighborhood. Think about one of your favorite places. Got something? Okay. Anybody want to volunteer what makes that place special for you? It may be related to built environment things, but it doesn't need to be. I'm just curious what you do like about it. What makes a place great in your mind?
It has a lot of nature.
Okay, lots of nature. Wonderful.
I like the ocean, and my best vacations are we just got back from Tybee Island. We biked everywhere.
Biked everywhere on your vacation, and you could probably see the water.
You could ride your bikes to dinner. Yeah. All the vacations I've taken in Myrtle Beach, the places I like that you could bike, and I don't feel that in this community.
Yeah.
I don't feel that.
Great.
I'm thinking of a place that has very wide sidewalks in their downtown, which are safe, and they have a great deal of public transportation. They also have bike lanes on those sidewalks.
Oh, okay.
And they also have bike lanes on their state highways.
Bike lanes on their state highways. Wow. So you can really get wherever you want to go, probably within
Pretty
that area.
much.
Anyone else want to volunteer? I didn't plant these ladies, I promise. But I think, to the point, and again, to the point that was just made, I had heard a national speaker one time say, it should be telling to us, it should mean something to us that we vacation, we spend money to go to places where we can get this. But that we are willing to live, we allow our elected officials, our community leaders, and that kind of thing to not create those environments where we spend all of our time, where we pay our property taxes and our other local taxes and that kind of thing. That it's part of what makes vacation fun, I guess, and that's why it's a vacation. But it's also very much something that we could have as part of our day-to-day life. And so to use this term complete streets, again, I'll come back to it, but it's really saying streets that are designed for all users, people of all ages and abilities, whether they're traveling on foot, by bike, in a car, on a bus, that kind of thing. Can you see it? It might be a little bit hard to see, but as you look at this picture, what looks comfortable, inviting, safe about it to you? You can shout it out.
It looks like it has sidewalks, and it looks like it's a crosswalk.
Yeah.
Which a lot of places don't have those, and I always feel intimidated when I cross the street. Because in Evansville, I'm never sure if people are going to stop and come out the street.
Yeah, great point, great point. So yeah, very wide, clearly visible crosswalk and a sidewalk as well.
But
What else?
It also has the buffer between the sidewalk and the street that makes it even more safe.
Absolutely.
Than a regular sidewalk.
Yep, so you're not against that whizzing traffic. It's going by at a high rate of speed.
It has trees, which
Trees?
makes it pleasant to walk.
Yes, absolutely. Shade, if it's a hot summer day, you can step under for a little bit.
Is it a light or is it a different?
It is actually a light. Yes, this one, if you're looking at it. Yep. So that is lighting, which is very important, and we would call that street scale lighting. So it's shorter than a traditional street lamp that's got like an overhead kind of shining down. Trash receptacles, excellent. Yes, and this one, in fact, has a recycling and a trash next to it. Pretty fancy for for a lot of places, but yes. Benches, right? benches, particularly with older adults, benches are very important. Again, we want people to be walking, but it's fine to walk for 5 minutes and sit down, and walk another 5 minutes and sit down. And so that means there have to be places to do that. Anyone want to point out anything else?
Well, the lift on the car kind of makes me think that it's safe to, I mean, when I look at that, I think of activity and movement and people moving around.
Yeah. The fact that they brought a car with a bike rack to the area means that, yeah. And there's bike parking, and the bike is leaned up against the building. Might be hard to see.
It's handicapped accessible too.
Yeah, I was just going to point that out. So this is a ramp, so it's ADA accessible, built to standard.
Looks like it has pretty good signage.
Mm-hmm. Yep. Wayfinding is a really important piece. How far, what I need to walk to get to the library. How far is it to, or what's that direction in general? This is an image of the Cultural Trail in Indianapolis, headed towards Fountain Square, if any of you know that area. Have you heard of the Cultural Trail? It's gotten a lot of attention. Some people are kind of tired of talking about it, actually. But it's an incredibly huge investment. It's about an 8-mile route, basically a loop with several spurs that includes both bike and ped facilities, lots of art and other features that really make it an incredible place to be. So it's definitely something to check out next time you're in Indianapolis. I tend to make sure to make the point to people like, this is kind of I don't even know what term, the Cadillac version of bike ped facilities. You can accomplish the same thing spending much less money. The bottom line is there was a commitment to do this. There was energy behind it, there was political support, and there was actually a lot of private foundation development and money that went into building it. So the bottom line is we know how to do it, right? This is literally a snapshot with all of those great features that you all pointed out. But unfortunately, we too often end up with things that look like this, right? We have people who are cycling squeezed onto roads where, they cannot feel safe, right? That person cycling cannot feel safe there. Certainly we don't know the man. I don't know the man. I don't know the circumstances. But my guess is if he had another way to get where he was trying to go, he would have used it. He's biking because biking is his choice. Biking is the option available to him, and yet he's forced to bike in a place that is inhospitable. This woman is trying to cross the street. That's certainly not ADA accessible. If a person's in a wheelchair, using a walker, a mom pushing a baby stroller, right? That's not an environment that would be safe or welcoming. Again, sometimes active transportation, which is what yay, physical activity, active transportation gets called utilitarian travel because it is accomplishing a purpose. And that's fine, it doesn't sound as fun, but it's part of it. But clearly this is utilitarian travel for the people with their groceries in the cart, right? They had to get groceries, they're walking where they, assumably on their way home, and they're forced into this narrow little area that's not inviting, that doesn't feel safe, and that puts them at risk. Another example of a bus stop where a person who was in a motorized chair or a non-motorized chair, or even had any limitations with the ability to step up on the curb, wouldn't be able to use that stop. And I will say, one of the things particularly, I don't know a lot about your METS system here in Evansville, but what happens a lot of times we've seen is that people who have some kind of physical limitation, but that potentially could ride what we call fixed route service, so they could go to the bus stop and do that, because they cannot actually access the stop. This is an example. They have to use the on-demand paratransit service and be picked up essentially door to door, when there could potentially be a stop within a proximal enough distance that they could use it, but it's not accessible. And we've got some transit providers in the room, right? So are you aware of how, has that come up as an issue where you're serving on-demand clients that could potentially use fixed route?
I think we've made a lot of improvements with our bus stops, and they are accessible, but we do have the other door-to-door too. So
Yeah,
there must be
okay.
situations that they can.
Yeah.
But they remodel a lot.
Good. Very good. Very good. Then again, just some additional examples. And one of the things I'll tell people a lot of times is if you take nothing else away from my talk, I'll ask you to take away two things. One, to pay attention, to look at your streets, particularly if you're driving, which most of us do, to look at the streets you drive on in a little bit different way, with different eyes. See them from the perspective of someone who's not protected by 2 tons of steel. See them from the perspective of an older adult who might just be trying to get out into his or her community for a little while. And I'll say this again a little bit, but slow down. That will be my other message to you. Anyone have any questions before I go on? Okay, I'm going to go through a number of slides here in a pretty quick amount of time. The bottom line is we need options. And yes, I can stand here and say it, but we've got lots of data, national surveys, that kind of thing that bear this out. About 1/3 of Americans don't drive. Those numbers hold for Indiana and most local communities. When you look at people who are too young, too old, who have a disability, whether that's a longer term or a short term, many of us will be or have been temporarily disabled, unable to drive for a short period of time. And that, when we think about getting to work, doing our daily living, can impact significantly. Most people would like to drive less than they do, spend less time in their car, but they don't feel like they have a choice but to hop in it. This is some encouraging news that we like to share, and again, national survey data, but we can assume similar figures for local communities, and that is that about half of all trips are shorter than 3 miles. So 3 miles would be like a 45 to an hour long walk, but as a bike ride, that's probably a 10 to 15 minute bike ride for most people. A full quarter of trips are less than 1 mile, so a 15 to 20 minute walk for most adults. And yet, almost 3/4 of those trips are made by automobile. And so again, that's something else you can sort of do as your day-to-day life. Take a look at, we're used to hopping in the car and driving down the street. Pay more attention to what is that distance? Could I make that? Could I substitute that as a walk trip, a bike trip, that kind of thing? And that quote I just love to use. It's a whole concept of induced demand that we're not going to talk about. But the whole idea is that widening roads, which we're so fond of doing, we add lanes to reduce congestion, actually induces more car travel. Induced congestion is the term. But it's like loosening our belts to try to lose weight is the analogy to widening roads to reduce congestion. Specifically with older adults, almost half say it is unsafe to cross a major street near their home, and more than half say that they would like to walk and bike more if their neighborhood allowed it, if those improvements were made. Almost 1/3 of adults who have a disability lack adequate transportation, and as a result, they don't always get the medical care they need. They can't get out to socialize with friends. They can't participate in community activities. They are very dependent on other people and potentially family and that kind of thing, and if those systems are not in place, then it makes it much harder. And this gets to the safety element I touched on earlier. Older adults account for 18% of pedestrian fatalities, but only 13% of the population. So we know we have this disparity with older adults bearing a disproportionate burden in the traffic system. The other thing to know, again, as much on a personal level as anything, although this is a policy approach we're increasingly looking at, is neighborhood speeds. So a person who's hit by a car traveling 20 miles per hour only has a 5% risk of death. If they're hit by a car going 40 miles per hour, that risk of death increases to 85%. So speed correlates directly with risk of death. And that's why speed zones near schools, near parks, neighborhood speed zones are so important. And we are seeing more attention. It's happening in Europe quite a bit right now. We're seeing some of it in the larger cities here in the US, but to move down to what we call 20 is plenty, to basically have 20 miles per hour be the standard speed limit. Yeah, it tends to be 35 here. But when you specifically look at safety, the risk drops significantly for the pedestrian, and honestly, it's seconds difference for most people who are traveling. There's a great report from Smart Growth America and the National Complete Streets Coalition called Dangerous by Design that essentially makes the case that pedestrian deaths are preventable. Better design, better practice, better policy, and regulation. So, we're going to talk for a few more minutes about how we get safer, healthier places for older adults, for people of all ages and abilities. We really have to have a vision for what we want to see, right? It's about thinking about, collectively, what do we want our community to look like? Maybe I want it to look like my beach vacation. Maybe I want it to have more green space and more nature. I want to be able to walk or bike. And to, you know, as you go through neighborhood visioning or community-wide, I know you did the Voices project here in Evansville recently, you know, really, and I know a lot of this emerged as part of that. These are things that increasingly people want to see. You've probably heard this, you may be living it in your own life, this convergence of really priorities and values between baby boomers and millennials. They are interested in many of the same things, and particularly when it comes to where they want to live, how they want to get around in the communities where they live, just where they want to spend their time and invest their time and energy and money is really important. We have to look at land use and transportation planning in the context of health. There's another national movement, I haven't seen really much of it in Indiana, but it's health in all policies. So it's the whole idea that in everything we do as communities, as a state, we can be looking at how it impacts public health, how it impacts physical activity, how it impacts healthy eating, those kinds of things, and ensuring that if, at a minimum, if we're neutral there, we're at least not working against it. And then we have to do what works. We have to institutionalize what we know works. This work is very much about partnerships. I appreciate that you touched on the Healthy Communities Partnership that grew out of work from the Wellborn Baptist Foundation and some funding through the Centers for Disease Control and Prevention. We've been working in a 7-county region here in southwestern Indiana to look at bringing together people who can start looking at how do we make some of these built environment changes, how do we get more active transportation options in our communities. You touched on the Ys. We really appreciate the Ys have led in many communities on Complete Streets efforts on much of this work. The realtors, specifically in central Indiana, have been very helpful. This is one of their national publications on Common Ground, it's called, and it says Communities for All Generations, Active Living for Seniors and How Millennials Move, Building a New Suburbia. So lots, I mean, if any of you have not really looked at the reports, the literature, even the research that's out there about all of this, there's more than you could ever read. So I'm happy to get you in touch with some, but you know, as helpful. But just know that increasingly, there's something in this for everyone. So kind of, you know, doesn't necessarily matter what your interests are, what your priorities are. There's something here for all. The other thing I wanted to touch on was a newly formed coalition that's called the Lifelong Indiana Coalition. It's grown out of some work that the Indiana Philanthropy Alliance, which is the statewide association essentially for all of the community foundations and other foundations, has done with the national funder, Grantmakers in Aging, but to form a network of partners who are seeking broad support for more attractive, livable, competitive Hoosier communities for people of all ages and abilities, and so that we can stay in place, right? This whole idea of aging in place, that people can come to a community and stay in that community for as long as they want. The Lifelong Indiana Coalition has really just probably been in about the last year that there's been some work going on with a lot of statewide organizations, mostly meetings in Indy and that kind of thing, but if that's something that you'd be interested in learning more about and getting plugged into, let me know. And also, we expect to be getting out into communities around the state more in the year ahead and beyond. I couple of the Lifelong Indiana Coalition priorities that, these are the Lifelong Indiana Coalition priorities. I started to say the ones that relate to us, but you'll say they all really relate to what we're talking about. So we have to engage seniors in the planning process, ensuring that when formal public plans or even more community-based organization planning is going on, that they're at the table, that their voice is not just being heard, but being integrated into that. We have to ensure a range of affordable housing options for all stages of life. Things like universal design, visitability, those terms that really talk about how do we build housing, how do we retrofit housing that ensures that a person can stay in it once they've had a stroke or had a fall and need different accommodations, but obviously want to be able to go home. Access to transportation options is key. I've obviously talked about that a lot. Land use and zoning tools are really a key driver in terms of getting where we want to be. We want to support the economic well-being of adults and caregivers, and we ultimately want to strengthen our community assets, amenities, and supports. Because it's very easy, my work, I can stay very focused on the infrastructure, right? I can talk about sidewalks and trails and transit all day long. But this whole idea of community assets, of engagement, of the social interaction, that's what makes our day-to-day life worth living, right? That's what this is about. And so, I'm well aware that I can get very caught in the concrete, literally. And so your role in kind of bridging this to the work that you do is to really help make that case for why being able to go to the park, intergenerational activities, these community third places, as we call them now, where people interact with each other, can learn from each other, and can have some fun, is really important. Just want to make sure on time. Okay, I'm getting close, I know. This is it's going to be difficult to see, and I'm sorry. This is a graphic from the Atlanta Regional Commission, which is essentially the AAA for Atlanta area. They have, we tend to call these communities for a lifetime, or lifelong Indiana, lifelong communities, they call it there. But this is really just showing again that this work, that the things that we need to see happen boil down to a couple of key areas and then key strategies. The top one in the middle is promoting housing and transportation options, encouraging healthy lifestyles, and expanding access to services, both, again, as it relates to older adults themselves, but also to the people who are caring for them. Policies, I've talked quite a bit about planning, sort of the how we anticipate changes that are coming in our communities and how we prepare ourselves to do the work that will get us there is really what planning could be. There are lots of federal, state requirements around planning for communities. What we're hoping to do is shift the whole basis of these planning documents, of the planning processes, to, again, include older adults in them, and also to ensure that these things that we want to see happen are priorities within that. Programming are things that can be done more like, as a very simple example, like walks in the park that are targeted at senior adults. So just bringing people together, helping them do things that they might not otherwise do on their own, but that bridge this connection to the built environment. Projects are more of the infrastructure changes that can be made, that kind of thing, where senior housing is located, where facilities are built. Siting, we call that, is a really key place. A lot of times we're seeing senior housing or senior facilities built, at the fringe of town, where there's no way even a person of the most capable physical abilities could walk to services that they might need. Whereas if we can look at having that built or placed or redeveloped in an area that already has sidewalk infrastructure in place or is already near services, that's really important. And then we talk about performance measures as another, we call these our Ps in the work we do. Performance measures just to ensure that we're monitoring the impact that it makes and that we're getting the changes we want to see. Ultimately, I would argue that it's about prioritizing walking, implementing complete streets policies, adopting design guidelines, ensuring that access and connections to transit, which we talked about, and requiring the participation of private development. So lots, increasingly as we come through the recession, senior apartments are being built, new stores are being built. It doesn't matter that it's older adult specific. We have to require those developers to be putting in infrastructure that accommodates all ages and all abilities. I'm going to just go through these a little bit quickly here. So, complete streets, I've used the term several times. You can adopt a complete streets policy, and you can also build complete streets, right? So it's an approach. It says that we're designing, building, maintaining roads for all ages and abilities. There's mine for everyone, 2 to 102. We now have 12 complete streets policies in the state, covering 46% of Hoosiers. You have one for the Evansville Metropolitan Planning Organization. We've got one for Indianapolis in the region, some other communities you can see. The thing about the Evansville Metropolitan Planning Organization policy is that doesn't necessarily mean that the city of Evansville itself, when it's doing projects, has to comply with that. So you really need policies at every level of government because of the way transportation funding and decision-making works. And we're very close to getting an internal complete streets policy adopted at the Indiana State Department of Transportation, which we hope will make some significant improvements in projects that they do as well. I've talked about public transit a little bit. I would say this is one of the key issues facing us in the state at this time. We have chronically, historically, hugely underfunded transit service. We have, and again, I'm not, you guys can tell this story better than I, significant unmet demand for transit services, particularly among older adults and people with disabilities. And we're looking again at some legislative approaches, but if you are interested in getting more involved in advocacy work around transit funding and how we ensure more transit service gets in place, particularly in our more rural areas, I'd love to talk with you about that. I touched on planning earlier. Having housing affordability at all income points, rehab of blighted areas, infill development, that again gets back to sort of where are we building housing, where are we building services that people need, and can we bring it to where people are now, or are we continually forcing people to go beyond where they live? We've touched on open spaces, parks, recreation. Again, not just the physical health benefits, but the mental health benefits of nature, of time spent in nature are huge. And whether that's things like community gardens, whether that's parkland, whether that's trails, really important to ensure that older adults can access that as well as others. And then our work doesn't focus much on healthy eating, but access to healthy foods is a key piece of that. And there are lots of ways, we're increasingly seeing ways that healthy foods can be, again, sort of brought to people where they are, as opposed to forcing them to go, or then even to not go, to restaurants, or I'm sorry, to grocery stores and that kind of thing. So I know, was it Fave? Is that what it was called? The fruits and vegetables for Evansville, I think went to a couple of senior housings with the mobile market, and I know that was a pilot project. I'm not sure where it stands right now, but looking at how, again, we get healthy foods to people who need it most is a really key aspect of this. So in closing, I hope you've learned a little bit. I would love to have an ongoing conversation with you all to welcome you into our Health by Design work. You can get on email lists, you can participate when and where it makes sense. Don't forget about the Walk Summit. But really just learning more, getting involved. When you see the public hearing sign go up on a parcel, look into that, figure it out. What is it, private development? What could they be doing to ensure access for all people? Wellborn Baptist Foundation has some great initiatives that you can get involved in. As there's lots of great work going on in Jasper as well, and I, to probably a limited extent, can help put those of you in other areas in touch with others who who are already moving forward in this work. So hopefully I've given you some new information. Hopefully you can think about these things a little bit differently than maybe you did when you came in. And unfortunately I've gone a little long, but I'm happy to take questions and to stay to chat. So thank you. Do we have time for one or two?